What if the way you eat now could change how you think, move, and feel 10 years down the road?
Is there one way to eat to live a longer, healthier life? Can food lower our risk for heart disease, diabetes, even Alzheimer's?
We pose these questions to Dr. Eric Rimm, a nutrition scientist and professor at Harvard's T.H. Chan School of Public Health in Boston. From bacon and seed oils to probiotics and personalized diets, he explains what the emerging science actually says. And what inquiring minds want to know. What does Dr. Rimm's diet look like? Let's dig in.
Welcome to the Health Education Series. I'm Sally Lewis. Grocery stores are filled with food and labels that promise everything. But how much of it stands up to true science? What is the optimal diet for living a long, healthy life?
It's a fun one to think about because human bodies are incredibly complex. And to think there is, you're going to wake up in the morning and say, okay, today I'm going to have a diet to prevent heart disease. And tomorrow I'm going to have a diet that prevents, Alzheimer's disease. Obviously, we don't know that ahead of time.
There's no secret sauce in what he recommends. It's something you've likely heard for decades.
I think plant-based diets or plant-forward diets is what we like to call them sometimes. Diets that are high in fruits and vegetables, and even that can sometimes be too generalizable. When I think about a vegetable, I don't think necessarily about just eating corn, potatoes, and peas. Just having the starchy vegetables probably is not as good as having the colorful vegetables, dark green leafy vegetables, and fruits that are also colorful fruits, berries, and other types of fruits that also are rich, not just in vitamins as we know them, but also rich in polyphenols and other components that we think are important for healthy brain aging and healthy heart aging.
Polyphenols are nutrients in plants and plant-based foods that help your body manage inflammation and may protect the brain and heart.
Besides fruits and vegetables, I think we do try to encourage people to eat less meat. And I think that may not come as a surprise to anybody. Specifically, processed meat that's gone through manipulation of some kind where things are added or taken away or cooked at high temperatures or things like that. Those types of meats tend to stand out really as putting people at higher risk of a number of different chronic diseases, whether it be cognitive aging or cardiovascular disease and even some forms of cancer. So if you do have meat, have small portions, have it only, a few times a week, as opposed to having it twice a day.
And then there is the importance of fiber in your diet.
When you're getting grains, make sure they're whole grains or try to get 100% whole grains. And also those fruits and vegetables that are higher in fiber. Fiber seems to interact with a lot of other systems in our body and seems to be the one thing that does keep standing out for many different chronic disease conditions, the importance of fiber. We have fruits and vegetables, we have whole grains, we have try to reduce the amount of meat and specifically processed meat. We do see benefit for fish, and that may not come as a surprise to some people, but it is one of those reoccurring things that mostly for vascular health and some cognitive health. And that's obviously fish that's higher in omega-3 fatty acids.
What about the freezer aisle and the cans when it comes to fruits and vegetables? Are they as healthy?
You don't lose any of the nutrients in frozen fruits and vegetables. So that's an option, especially for people living alone who don't want to buy a lot of fresh something they're worried about going bad, that having a bag of frozen spinach and taking a little bit out at a time is just as healthy as cooking fresh spinach.
Just be careful about the amount of added salt. Consider low or no salt options.
The important thing is first to look at the nutrition facts panel on the back. A lot of canned vegetables specifically have a lot of salt added to them. Especially as people age, people are worried about their blood pressure. Elevated blood pressure is the cause of a lot of bad outcomes in older populations. So, it's very easy to pick up a can of canned beans and go, oh my gosh, there's 500 milligrams of sodium. I've seen them with like 800 or 1,000 milligrams of sodium. And if the average person, in their 60s only needs, 1,600 milligrams or at the most 2,000, then you're getting a lot just from that canned vegetables.
Beyond what's on your plate, there's a lot of talk about personalized nutrition, diets tailored to your genes and gut microbes.
In 2010, I sat on the US Dietary Guidelines Committee. And, at that time we were struggling with how do you give guidance to the entire general population? One size clearly doesn't fit all. And at that time, the guidelines were for anybody over 2 years old. So obviously, how do you give guidance to a 4-year-old versus a 40-year-old versus a 90-year-old? You probably will have different calorie requirements and vitamin requirements. But what as time has gone on, the technology has gotten better and better. So we're getting closer to the point where we can know a lot more about you, and then to say you may do better more with this than that. The first thing we can do is do a genetic scan of you, which means that you can give me a little bit of blood and we can look at all of your genes and look at all the different slight changes in your genes versus mine versus anybody else. Humans have about 20,000 genes that dictate our hair color, how tall we are, our eyes, and how we metabolize things. So that's 20,000 genes. That's a lot of processing going on. The microbiome probably has 200,000 genes, maybe even more, that do a lot of other things that impact what's in our blood, how we metabolize food. And that is exciting. And it's scary as a scientist because your microbiome does not stay the same. Your human genome pretty much stays the same your whole life. There are things that go on that get tweaked and get turned on and off. But your microbiome, if I measure it now and I measure it a year from now, it's 60 or 70% the same. I can tell you, looking at the science that was published, and I just met this morning with our microbiome group, and everybody's on the cutting edge, and it's not like there is a magic. We have figured out exactly how to tell people to eat based on their microbiome and their genetics and what's in their blood. We're getting there, but it's gonna take a bit more time.
The same caution applies to another booming business, probiotics.
It's a huge market. As if you go to any supermarket, especially the higher end supermarkets, they could have a whole aisle, a whole refrigerator thing full of probiotics that can sell for $30, $40, $50, $70, $100. And companies are making great claims about, it has a gazillion this and, live microbes. It's almost like, the funny thing is, as I said, there's 200,000 plus genes in the microbes and many, many, many hundreds and hundreds of different microbes that you can have. So it's like telling someone, I take a vitamin. Well, which vitamin is it? I don't know. It's a vitamin. That it's like what's in the probiotic is so different by all the different brands that are out there and what's living and what's not living. I think it's still the Wild West, and I'm not comfortable telling everybody to take a probiotic yet. I think you should get it from food. I think have yogurt, have kimchi, have kombucha. There's lots of opportunities to get microbes in your food, and I think also you're getting healthy food then.
Another hot topic in the nutrition world, seed oils.
Seed oils are vegetable oils made from seeds that all of us have been consuming for a very long time. Seed oils are very, very healthy from the oil standpoint. So if you're trying to decide on should I have palm oil or coconut oil versus canola oil or versus sunflower oil, the oil is so much better if it's a seed oil. Mm-hmm. So it's not like in the last 2 years, suddenly we've said, oh my gosh, all this way that we get canola oil is suddenly detrimental. Almost 100% of that is the oil. Now, it's kind of like telling people not to drive because there's 40,000 automobile deaths every year. Oh my gosh, should we all go off the road? No, we need cars to commute. We need cars to go on vacation, but we shouldn't get rid of all seed oils because in a very small, cases where there's refining, there may be something else there. It's the oil itself is so much more beneficial than what you would have instead.
Dr. Rimm says butter is much higher in saturated fat than olive oil, soybean oil, and corn oil. Translation, butter is more detrimental to your health. So, what does a Harvard nutrition scientist eat on the daily?
I try to live like the Mediterranean diet. And after Halloween, I had a few more pieces of candy than I did do during the rest of the year because we had leftover candy. Occasionally, I like to have a few other things that are probably not part of the Mediterranean diet. But I'd like to, I probably have red meat twice a year, once a year. I eat fish a couple times a week. I eat chicken once a week, maybe. Frequently, we have salads with beans and lots of vegetables on them for dinner or for lunch. Um, when I don't have breakfast every day, but on days that I do, I have yogurt with granola on top of it and blueberries.
In a nutshell, what does the emerging science tell us about how to eat? Eat more colorful fruits and vegetables, high fiber whole grains, beans, and fish. Eat less processed meats, especially bacon. Frozen and low salt canned foods are good alternatives to fresh. Don't fear seed oils, they are still reliable fats in a heart healthy kitchen. Consider a lifestyle that includes diet, enjoyable regular exercise, and social connection, which all support healthy aging and cognitive function. Part 2 of How to Eat tackles the protein question. How much do you really need? We talk with Dr. Stacy Bell, a nutrition expert and member of the Civic Association's Healthcare Committee, to separate fact from hype.